In New Orleans, a bus carries those in need to a hotel being converted into a shelter for the next month.
And I'm one of the homeless people, and I like to say the city of New Orleans has done a great deal when they have taken the homeless people off the street.
You ready? Alrighty. Alrighty, here you go, converter.
If a person has a fever, they are not allowed in. Those accepted are fed 3 meals a day and given their own room to help stop the spread of coronavirus on the streets, which is a growing issue in the Crescent City. New Orleans now has the highest per capita death rate from COVID-19, with at least 200 known cases. The hospitals are stretched thin as the number of infected continue to rise.
There's a tremendous amount of chaos. This system was not set up to handle COVID-19.
For decades, New Orleans doctor William LaCourte has been on the front lines of disasters in Louisiana. Right now, he is treating patients in hospitals and nursing homes and says supplies are dwindling and beds are filling up.
The key, in my opinion, is quickly getting rapid testing out. It'll change the whole nature of this pandemic.
Most coronavirus testing takes 5 to 10 days to yield results, which means suspected cases still fill up valuable bed space.
Therefore, we are putting people in the hospital, and if we suspect it, we're putting them in isolation. We're burning through tremendous amount of personal protective equipment, some perhaps 40, 50 different sets on patients that don't need it.
So if the testing results get faster, the decision-making becomes more turnkey, making the resources more available.
Because we feel things are only going to continue or get worse at this point.
This nurse just quit her job and doesn't want to be identified. You have just resigned as being a nurse. Why, and is it because the conditions were too intense?
Nurses and all healthcare workers are extremely resilient people, and we've been through worse. You know, we've been through Katrina, and we'd be the first to leave our families to go take care of yours. But personally, for me, I have to really weigh whether I'm able to handle that physically and mentally. And I'm able to help in other ways through other positions, and that's what I think is the best course of action at this time.
And I need N95.
Senior living facilities are also straining. This administrator and registered nurse runs a local care facility and also didn't want to be identified, but is pleading for help.
I am a healthcare institution too. I am fighting for my life for what I can get. I even have ladies that are making cloth masks to put filters in so that I have more. I'm looking at options every direction. I will do what it takes to protect my staff. I will do what it takes to protect these residents.
New Orleans remains locked down. There is no music on street corners like usual, no people in the famous restaurants, and no revelers walking the old streets of the French Quarter.